You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I spoke with Dr. Shannon Reed about post-racing health concerns and opportunities for thoroughbreds. The Disease Du Jour podcast is brought to you by Merck Animal Health. Dr. Shannon Reed is a past thoroughbred makeover competitor. She was a consulting veterinarian for the Retired Racers Project and a driving force behind the implementation of the Thoroughbred Makeover Arrival Exam. She is a clinical associate professor of large animal surgery at Texas A&M University and has over a decade of experience in equine surgery. Dr. Reed has previously published peer-reviewed research on thoroughbreds retiring from racing and has served as a licensed state racing commission veterinarian. Thank you, Dr. Reed, for joining us.
Thanks for having me. I'm excited.
Yeah, I'm really excited to talk about this too. I'm sure lots of vets see thoroughbreds pretty frequently in their practice, and as we know, they can be pretty complicated sometimes. So do you want to get us started by just giving some ideas for how veterinarians can help facilitate the transition from the track to a sport career?
Yeah, the first thing is to be aware of what the actual common issues are for thoroughbreds coming off the track. And maybe not so much the myth, but the reality of what the common issues are. So we've been able to do a bit of research and look into this. And the common things that people need help in transitioning are often maintaining good body condition when transitioning from a track body to whatever their next sport or non-sport is without having a significant amount of weight loss and muscle mass. So having some awareness of what that looks like and the best ways to do that, and getting proactive with clients about what it means to feed a thoroughbred and what it looks like to ease a metabolism from athletic on the track, certain pounds of exercise into not as much demands, and what that kind of looks like, and understanding that in 5 years, they might be an easy keeper, but kind of what that looks like. So the biggest thing we know is help with transitional diet. We also know that traditionally it would be helpful to, if at all possible, do a post-purchase exam. So frequently people get thoroughbreds off the track without getting a pre-purchase because it's difficult to get that organized on the track, or they come through different organizations. But I highly recommend doing a post-purchase exam, looking them over, looking for obvious musculoskeletal issues that might need to be dealt with, and then potentially thinking about taking some radiographs or x-rays of the feet just to get an idea for the farrier of best ways to help them, because we know that feet can be an issue transitioning, especially honestly for those horses that are coming from lower level claiming tracks. They don't maybe tend to have the same foot surface and things like that. So helping their feet out for veterinarians is big. And then speaking about ulcer treatment or prevention specific to that program and to that horse. So those are the three big ones: is understanding, easing their muscles and body into a good body condition score, thinking about helping their feet, and then ulcers, with a side of looking for musculoskeletal issues.
Are there any other health issues that you see pretty commonly in horses that have recently retired, like any specific musculoskeletal injuries that are pretty common in these like very newly off the track thoroughbreds?
Yeah, so there are generally things that we see commonly. So depending upon what type of racing they did, often an area that takes a little bit of repetitive issues is the fetlocks will generally need some attention. And sometimes those are soft tissue injuries or just what we would call a synovitis or inflammation of that joint just from hyperextension and things like that. So it's actually really common for thoroughbreds to come off the track and have just raced recently. And even for a period of time after, they'll flex positive to their fetlocks, but they don't actually have arthritis or a chip or a fracture, but they do have just soreness and synovitis. So that's actually really common to have positive flexions coming off the track in the fetlocks. You let them go for a few weeks and then those go away. So that's something we think about. We think about, well, people call them chips. And in the veterinary world, we tell the students not to do that because it's like, well, chips and guacamole. But what that means is a piece of bone has fragmented off in the joint, probably from some side of hyperextension. So that happens pretty commonly, and taking some x-rays of a joint that's puffy might be helpful. And not all chips need to come out. But if they're early in the process and they haven't been there for a while, taking them out can actually help the joint long-term to not develop arthritis. So understanding that little fragments and chips of bone in the knees or the fetlocks are also pretty common. And that's a kind of some of the bigger issues with joints, is to look and see if there is a puffy joint, to go ahead and take an x-ray and see if there's a loose floating fragment. And also, if you get a joint and it looks scary, to have it looked at by a veterinarian who also works on the track, because there's some things that can look scary on x-rays and really aren't going to affect them for long-term use. One example of that is osselets, which is basically inflammation at the attachment of the joint capsule. And horses with osselets can actually do well long-term. So things within the joint would be fragments of bone coming off, and other synovitises would be issues to look for. When we talk about, besides musculoskeletal, diet, and body condition, they actually have a pretty low incidence of things like neurologic conditions. So wobblers can happen, but it's not very common in thoroughbreds. We know, and I think we'll probably get into this later, we know that a lot of thoroughbreds have radiographic evidence of what's called over-impinging spinous processes. That doesn't mean they have the disease of kissing spine. So common actual health issues are going to be fragments, fractures in the joints, osteoarthritis from that, ulcers, and soft tissue injuries. And the rest of them can occur, but they're not as common.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health's Protozil 1.56% diclazerol anti-protozoal pellets. Get the scoop on Protozil easy to administer top dress alfalfa pellets. A safe and effective treatment that starts working fast without a loading dose. Learn more at merckanimalhealthusa.com. Do not use Protozil in horses with known hypersensitivity to diclazerol. Safety has not been studied in breeding, pregnant, or lactating horses. For complete safety information, please read label. Do you recommend a down period for horses when they come off the track? And do you think this mitigates the risk of potential health issues, or is it more of an optional step?
I think it should be individual horse and situation dependent. So if I get an athletic horse that's young, that comes off the track and is just getting started, and what I mean by young is they're 2 or 3 or sometimes 4, and their rhythm and routine was just getting started at the track. And if you pull them out of that and throw them in a field and change their diet and don't give them a job, they're probably going to be naughty and they're probably going to injure themselves. And so I think some of those horses actually don't benefit from a long downtime, because you just leave them out and they start to lose muscle mass and they have to come back. So maybe doing some things with those animals that are used to a routine will help them actually ease into a life off the track. And then there are horses that have raced for years and just need a mental break. And allowing them to be a horse is actually a good thing. So an example is, if you take a horse that's raced 47 times and they're a little bit tired and they got a little bit of a blank stare when you take them off the track, and they've kind of been endorphined out. What I mean is they've just had a lot of stimulation for a while. Those horses would really benefit from some time off. And so would horses that have maybe tendon strains or things like that. But not every horse should just be put out into a field and let to have 6 to 8 months off, because you might actually get back a horse that's lost its way, if that makes sense. So yeah, I think downtime is really important for a lot of horses, and that downtime can look different. It might just be, now we're going to groundwork and practicing tying in a stall, and we're doing some things every day as part of your routine, but we're not working. And some horses might need work under saddle to then be able to learn to tie, because they're used to working and going out and galloping. So I think it's individual. I don't think that every horse off the track needs a year off to refresh themselves. I think it's situational to the horse and what they have for a routine and what's going on with their body and their mind.
Yeah, that's a great point, especially weighing the risk of pasture injury if they're not doing anything, and maybe they're not used to a lot of turnout as well. So
yeah,
I think
yeah. And you will do that, and you will bring them up, and they will have lost all of their top line. And then they've lost all their top line, and now you have trouble with saddle fits and things like that. So sometimes keeping them in some work and keeping the top line going while you change it over is actually going to make your transition better for you than allowing them to just decompress and lose all the muscle. So there's varying ways to do it, but I think it needs to be individualized to the horse and the situation for sure.
Now, from a veterinary perspective, do you have any best practices for restarting horses off the track to prevent injuries and health issues?
Yeah, I think supporting their GI tract while they are being brought back and restarted is one of the most important things. And that may not mean that every horse goes on Gastrogard for ulcers for 2 months, but it might mean that you're doing frequent feedings and including a bit of alfalfa, and you're talking to your vet about having to do that, because I think having horses with ulcers cause behavioral issues under saddle that even predisposes them to injuries. So that's the first thing, is to get their gut in line. And I mean, that doesn't mean Gastrogard for 30 days, but that means talking about their diet and keeping them supported. I think best practices is to have a post-purchase exam done by your veterinarian and decide, if there's a soft tissue strain where maybe a tendon is a little puffy, but on ultrasound it looks good, that horse shouldn't be going into hard work for 6 months afterwards. It needs some time off. So from a veterinary perspective, the best practices is to figure out what's going on with the horse and their body and then put them into work in that way. And there are plenty of horses that can come off the track and do walk, trot, canter, under saddle, and start going over cross rails right off the bat. And it actually helps them to let down. And there are some that we say, okay, this joint does look a bit puffy. I don't see a fracture in it, but we don't want it hyperextending. We don't want it moving around a lot. So let's do a lot of walk if you can. But now you have a 3-year-old thoroughbred who we just said to walk under saddle. And yeah, they're used to tack walking, but they're tack walking in a barn. So I don't think there's any shame in putting those horses on something with the permission of your veterinarian to help make that tack walking go a little bit better to get them through it. So from a veterinary perspective, understanding what's going on with your horse's health is how you prevent injuries and health issues as it goes on later.
I guess transitioning to horses that have been off the track for a little bit longer, what are some common health issues that you might encounter? And maybe we can talk about kissing spine and the significance of radiographic evidence, but maybe no actual clinical signs.
Yeah, sure. Okay, so we'll start on the first part of it, which is the common health issues after they've been off for a while and transitioned into a sport career. I think that and I have data to actually prove this, is that for most race horses off the track, after a year, they are equivocable to their peers of other breeds and sports, meaning that they don't have any different issues at 1 year of time after they've been off the track and they've been in work and they've had several shoe settings and things like that. They are actually not any different to predisposition of problems than their peers, unless they had a specific injury that came from the track that you have to manage for arthritis. So maybe you're managing a few more of them for arthritis with your vet than of the general population. But by a year, we know that most of these horses are over whatever they needed to transition from track body and track issues to gen pop, if you will. That's the basics of it. But within that year, it can be a roller coaster and it can be rough, especially getting them through that. And so I think we can kind of look at the kissing spines a little bit as its own issue. When they have looked at research and within the state of California, whenever a horse dies on the racetrack, there is mandatory necropsy. And so because of those mandatory necropsies, we've gotten a lot of information about what is also normal for thoroughbreds. So maybe we lost them because of a catastrophic injury or a heart issue or things like that. But we've been able to look at their skeleton and look at that perspective. We also now have multiple studies that have said, okay, we have this population of thoroughbreds who aren't having problems, they're racing, they're doing well, let's radiograph their back. And it turns out that a large number of them have a conformation of their spine where their dorsal spinous processes, which is where we talk about kissing spines, that they make contact. And that could be because of their conformation. It could be, we don't know this, because there's a common genetic pool in a lot of thoroughbreds. So who knows? I'm just going to pick a random name. Let's say Seattle Slew. I'm not saying that at all, but let's say he was the one that had this conformation. We may have passed that down to a lot of them. So we just don't know. And so if you were to radiograph without any clinical disease and you're just like, I'm going to take x-rays of the thoroughbred's back because I'm afraid of kissing spines, and that's understandable, you're going to find a higher incidence of just the radiographic appearance of the spines touching in a thoroughbred than you might in the quarter horse. And so that's going to be right off the bat something that's hard to work through. And maybe most of those horses, if I have a graded stakes winner that's a gelding that retired and won $700,000 and never had problems on the track, but has impinging spinous processes, it's pretty unlikely that those are going to cause him problems later. But it is possible that once we change his body movement and ask him to use his back differently, that those might become what we call clinically relevant, meaning he was fine when he was running kind of back flat, head down, forehand heavy. And then we asked him to sit back on his butt and jumps. Maybe that they started bothering him then. But kissing spines, just seeing them on x-rays is not enough because we know that they're so common. There has to be other things that go along with them, like physical back pain, saddle fit issues, or when they are, like, let's say you had a horse, so you weren't sure if the kissing spines were an issue and nothing else was going on. And you gave them 2 grams of bute and then you rode them and they were like marvelous. Okay, well then I got to look towards maybe this is a pain issue. Maybe that means more. And maybe my veterinarian does blocking of those spinous processes and I ride them again. But we try to prove that that's the problem. So if you have a horse that has kissing spines on the x-rays and they're no different depending on whatever saddle's on them, they're the same and they can flex their back up and down. They don't have pain of their back and they're not resistant. They might just be sitting there. So they're complicated to work out and it needs to be more than one thing going on besides just the x-ray to say that they're real.
Yeah, that's a great point, and almost something maybe you don't even want to go looking for it if there isn't a problem. Is that something you would agree with?
Yeah, I think that's true. And so I would say that I'm not going to do a pre-purchase exam and look at the back on thoroughbreds at all, unless, like, let's say I've lost 2 horses to clinical kissing spine. I might not even want to take the chance. So it makes sense for me. But unless it's like a foreground problem that I just can't even deal with, I probably wouldn't take them because I don't know what they mean and they may never be a problem. But that's just me. So I think it's all about tolerance for risk. And you can find thoroughbreds that have clean backs and they might have another problem. So yeah, I would say unless it's something that's specifically important to you that you never have to deal with it, or the horse has clinical signs, I would not go looking for them. And in all honesty, my post-purchase radiographs, if I was going to get a horse and then look at it, or even pre-purchase off the track, would be only of the feet to know what my farrier has to deal with. And then anything that I know has both a large amount of swelling, is positive deflection, and I know that horse has a lameness, then I might x-ray that area because there's so many things on radiographs that it's hard to interpret what they're going to mean. I just personally want to check out the stuff that looks big and has something else with it that tells me about pain.
Yeah, that's a great point. So how can veterinarians help support thoroughbreds' long-term soundness after such a demanding early career? I know you said there's really no difference after the first year, but have you had a lot of success in keeping horses in sport into their teens and into their 20s? And what do you believe has contributed to that success?
I think it's less about the physicality of it, but you do have to deal with that in the first year. You've got to understand what they need as far as do they need injections for arthritis and what's an appropriate sport for them. So I think the thing that sets them up the most for long-term success is to find the right path for that horse's body type and capabilities, less so than what's their physical injury. So what I think keeps them in their sport until their teens and 20s is if they're going to be a barrel racer, that most of them are short and compact and able to drive. And if they're going to be a dressage horse, then they're set up for success with their training and conformation. I think long-term soundness is maybe not putting a horse into eventing that has visible arthritis of the fetlocks and then expecting them to stay sound at a higher level into their 20s, but putting them towards a dressage career or a trail career, or saying they're going to be a lower level eventer and they're going to need injections, is how you set them up for success long term. Is so helping the owner to understand, based on what you have, where does the horse best fit? And after that, I've seen many of them that are successful in their sports into their teens and 20s. Megan O'Donoghue is competing thoroughbred across the pond in eventing at an upper level event. And I think Palm Crescent is probably, I think he's 17 or 19, and he's going at a 5-star right now. So yeah, there's plenty of examples of thoroughbreds that have been successful in their sport into their teens and 20s because they were in the right sport and supported as any horse was. And early in their careers, they were set up for success by the choices that were made in their path.
Now, before we wrap up, can we talk about some opportunities that are available for thoroughbreds when they retire from racing?
Yeah, so there's a bunch of them now. And so the two main programs I think people need to keep in mind is a short-term goal for many thoroughbreds coming off the track is to participate in what's called the Thoroughbred Makeover, which is the flagship of the Retired Racehorse Project. So the Retired Racehorse Project is the organization that runs the Thoroughbred Makeover. And in order to participate in that, horses have to be relatively early in their restart career. So all of the horses there, except for a special category, which is called the broodmare category, all of the horses that are there have either trained to race, so they've started from a gate and had a timed work, or they raced basically within 14 months to 16 months of their retirement. There's specific dates for that. And they can't have actually started retraining until the year of the makeover. So there's all sorts of rules for that. That's an extremely popular venue to go through for people who are interested in taking an off-the-track thoroughbred and training it. And there's advantages to doing it. The advantages to doing it is we tend to call it the happiest horse show on earth. It's where 400 thoroughbreds come together from all over the country with lots of different trainers, and there are 10 disciplines in the makeover. So people can dabble in trying barrel racing or trying a dressage with their horse because they can enter up to 2 events. So lots of horses come. There's a fair good, if you win, there's a financial impetus to do that because there's prize money. So the makeover is one small part and an exciting part of opportunities off the track. The other exciting things that are available is to register thoroughbreds when they come off the track with the Thoroughbred Incentive Program, which is called TIPS. And sometimes that's more advantageous than others because lots of shows can apply to have TIPS classes. So you can go to an A-rated hunter jumper show, and maybe your thoroughbred, maybe they won't place as high of a warm blood because of a different discussion. But if it's a TIPS class, then you might actually get a special ribbon and some cash money prize for that show. And you can acquire points towards like end of year prizes and championship in TIPS. So the Thoroughbred Incentive Program is independent from Retired Racehorse Project. It's through the Jockey Club, and that offers some opportunities as well. And then there's just sort of like the general opportunities of having an amazing thoroughbred because they can slot into a lot of different disciplines. And even some of the trail horse organizations and the Western organizations are recognizing it. And we're seeing a lot of thoroughbreds actually in Western dressage because they have a different body type than traditional dressage, but they actually have the fitness and the bendability and the rhythm for the Western dressage. So the opportunities that are available are endless within sport horse organizations. And sometimes you're fighting a battle of thoroughbred's not as good as a warm blood, and sometimes you're not. Like if it's a timed event, it's a timed event. And then the two main ones are the Retired Racehorse Project's Thoroughbred Makeover, which is limited in how long a horse can participate in that. And then TIPS is a big one.
Do you have anything else that you'd like to add on the topic before we wrap up?
I'm pretty passionate about bringing them off of the track and making people understand that with the right resources, they can be successful at a huge amount of things. But that first year is a bit expensive and rough to get them through what it needs to be. And 2 years after the track, buying a thoroughbred that's been off the track for 2 years is no different than buying another horse that's been doing its job for 2 years. So we don't need to be afraid of the label of thoroughbred because of the problems that they could have, but we do need to be prepared for what it looks like to get through that first year.
Great. Well, thank you so much, Dr. Reed, for joining us. And thank you to our audience for listening. And a very special thank you to our sponsor, Merck Animal Health. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com. That's CSISSON@equinenetwork.com.